Colleagues, just to let everybody know, we're just waiting for the last few folks to come through the lobby, and then we'll have a start at 9:05. Thank you very much. Right, there we go. Good morning, everyone. Very warm welcome to all of the colleagues that joined us online today. We're very happy to have a session with you, and I think it's something that's probably been a long time coming. Just to get together and chat through the introduction and the launch of the SAHPRA engagement portal a little bit with our industry colleagues. We wanted to just share with you a little bit what we've been up to this year. We got off to quite a cracking start in January, and there's been all sorts of activities this past year, up to where we are now in September. You know that we've also had the rollout of one of the back office processing systems that manages the health product registration dossier documents as well as the evaluation. And one of the other components that we then wanted to introduce to you today is basically the SAHPRA portal. And I think before I get into too much detail, I will maybe just ask Ntokoza if he can just run through, I think, just some of the house rules. So what we'll have for today's session is we will use our Q&A to take in any questions. And can I please ask, as we run through the presentation, if you could pop through your questions. Hopefully we will have enough time at the end of the session to deal with those questions and answer some of them. And if there is any questions that we are not able to get to, we will be compiling a FAQ document. And I think it's also important to note this is one of the first sessions around the SAHPRA engagement portal. As we continue with the rollout and take some of the different modules live, we will continue to have sessions and discussions on this. And I think, Ntokoza, that's kind of the last one. Mel?
Yes, that's
Sorry.
correct.
Cool. Okay. Right. Then I think we can actually get going. Cornel, if you want to maybe just pop up your screen. I think before we ask Cornel to start the presentation, let me also then just introduce my colleague that will be co-presenting with us today. Cornel Liebenberg from Novus 3, Nuvotech. He is from the technology consultancy service provider, which we appointed through a tender process during the course of last year. We obviously concluded that process, well, in December of 2023. And of course, then January 2024 got off to a cracking start. Cornel, maybe if you just quickly want to introduce yourself, and I suppose we can then get started with the discussion.
Great. Thank you very much, Kristalna. Hi, everyone. I'm Cornel Liebenberg, based in Pretoria. I'm the solutions architect as part of the team on the SAHPRA engagement portal. Looking forward to sharing what we've been busy with you guys today. Thanks, Kristalna.
Thanks, Cornel. Right, so
Okay.
just running. Oh, sorry, Cornel.
No, you carry on.
Yeah, guys, clearly we misunderstood each other in the rehearsal, as you could tell. But then let me just quickly run through the agenda before I hand back to Cornel. So we've got just the basic introductions. We'll run through a little bit of the overview and the objectives. Look then at our health product applications process. And the ECTD receipt facilitation, how the orders and payments will work, account registration, registration for use of the portal, and then also touch on some of the future phases that will be coming soon. And as indicated, hopefully we will have some time to get into some of the Q&A. So I think first of all, for me, it was really just quite important to reflect on what is a customer stakeholder portal. So as we know, it's an online interface that is actually quite an important tool for us to provide really key, critical, and time-relevant information to the various stakeholders. Also resources and services that are related to some of the stakeholders and interactions. Certainly, we've got various services, not just the health product applications, but licensing, request for Section 36 applications, CPP certificates, GMP certificates. And we also have, through the stakeholder portal, the ability to have really good reporting, dashboards. It also provides a document repository for certain of the documentations as part of the different service requests. And of course, this two-way interface facilitating then communication between ourselves and our stakeholders. So some of the components that we find in the portal, of course, just from a user access perspective, where the different stakeholders can log in, look at their account information, and then, of course, if there's specific actions that they need to engage with, either update passwords, add a new user, inactivate an account for somebody that has left the organization. Also, information sharing. Of course, as we transact and we continue to do status updates or upload specific reports or query letters, that all of this information then is available through the portal. As I said, that then talks to the communication channel, facilitating then this easy communication between stakeholder and the organization. having little notification center, being able to see when we have sent through a notification or a document and shared that with you. And of course, then also the self-service capability, which for us is a key one, considering some of the challenges that we had with the DVP portal. So also then allowing the account administrator to manage the profiles of the users, also then to track progress of your service requests without necessarily needing to contact somebody at SAHPRA to have an inquiry about where something is or what stage of the processing it is at. Thanks, Cornel. Right, so the objectives for the SAHPRA portal is that we wanted to have a central portal or basically a one-stop shop where we can then interface with all of our different stakeholders. Also, we wanted to empower our applicants and different organizations to manage their own users. We have understood very clearly the necessity of creating that visibility and transparency around seeing where your applications are at. And as we interface some of the third-party systems, a lot of that tracking of statuses becomes real-time as we continue with the rollout. We also have through the portal the process of the fee calculation for a specific service order or service request that will be facilitated through the portal, also facilitating payments. So I think we'll spend a little bit of time just to indicate how that is set up for the moment and what a future phase would look like. Also then the registry management, so specifically as we are approving health products or licensing and approving licenses or amending, renewing product licenses, we will also be able to then update the different registries and also then be able to publish those in a more real-time basis. Very important aspect for us is just the data standardization. For SAHPRA also being quite active within the continent, as well as engaging with other national regulatory authorities, really critical that we speak a common language and that we use the same standard references, same ontologies for some of the terminologies around health products, for instance, and also for just managing some of the licensed or approved or authorized entities. So this is becoming quite critical for us. And as we have started the design and we are rolling out the different phases, we are being mindful of this, bringing in where we can references and checking certain standards, like for instance, the WHO drug dictionary using Metro ontology, etc. Another exciting element also is the introduction of AI or large language models that we are piloting and testing at the moment to see how we can introduce those in our applications portal to assist us with improving operational efficiencies. This is quite an exciting one for us, and hopefully it's something that we can discuss quite soon. Next slide. Thanks, Cornel. Right, so just going through the SAHPRA portal and I suppose some of the logics around this. So the reason why this is a very important first step for us in digitalizing the business process, and I say first step because from an external perspective, really, I think this is kind of like the first big-ish one we are taking on with industry. Of course, internally, we've already had some changes in the core business processing or back office processing systems. But for us as an external partner, a very big first step in terms of digitalizing all of our business processes. So as I said, very critical, the centralized access, making sure that we have that one-stop shop and we have got an easy way to communicate and engage with each other. Then this we also believe will enhance our ability to engage with our stakeholders, because we have created then a way for you to directly access information. As I said, not having that perhaps longish process running through sending a email to an email address, and then that takes time to acknowledge and answer, but actually having some of that key information that you want to know at your own fingertips. Also looking at the efficiency gains. So one of the key things for us is to try and improve the way that we process information. Also looking at reducing some of the administrative burden. And one of the things that has been challenging in the past is obviously receiving information and having to reprocess that. With that comes issues such as finger errors or capturing the information in the wrong place, or typos as they do happen. And with this, we believe that we'll have a much more streamlined process in terms of information that is captured, how we take that in, use that information then in terms of processing, tracking, and reporting back on the specific service requests. Also, as the data then becomes available, we are also able to derive some really good insights and start making more and more data-driven decisions. At the moment, the data gets processed. It sometimes is quite a tedious and a long process to extract some data insights. And with this information that's now in digital formats, it's much easier to put that through our data warehouse and run reports and be able to put dashboards in place. So one of the things which I think Cornel will talk to also is, as we continue to evolve and as we continue to digitalize our business processes, our portal needs to support us and be something that is scalable, so that we can continue to accommodate more stakeholders, different stakeholders, and also expand to include then different functionalities. From a transparency and accountability perspective, I think I've already touched on that. And this for us is a really important thing, not just creating, of course, transparency and accountability within the organization, but also making sure that that information which is relevant to our external stakeholders is available, and that we can start creating more and more transparency, as I said, really in real-time fashion. I think that is the key thing, is getting the information closer to the point of activity and being able to share that with you. And looking forward then to the improved communication that we foresee will be an outcome out of this portal, where we probably will also then see a reduction in the number of emails or additional phone calls that needs to be done to follow up, because the information will be there and you'll be able to access it in your own time. Thanks, Cornel. Right. Some important security considerations. I think for us, quite logically top of the list is security. Around that, looking at data protection. So also making sure that we have implemented really strong security measures to protect the sensitive information. And along with that, of course, the access control, making sure that our different users, whether they're internal or external, then have appropriate access levels based on the different roles that have been created, linked to then their different organizations. Second one is the user experience. So this really, for us, a key thing is to make sure that this portal that we want to launch is user-friendly and accessible to all of our stakeholders, internal as well as external. We wanted a responsive design, so we're really important for us also to make sure that our portal works quite well on different devices, so on desktops as well as then adaptable for mobile devices. The next one is the integration. So for us, again, system integration, very critical. We have different systems within the organization. already 2 other processing systems, and with the plans to also procure some additional software tools. Really important for us that those are able to integrate quite seamlessly with our portal. Again, focusing on this concept of having a one-stop shop. So very critical that we have that integration in place, not only with the systems, but also with our data warehouse that keeps all of the different databases and then reporting. So therefore, we are making sure that the APIs are in place, that we can then easily connect with these tools and services, and also have got a eye on the future, where there may be a requirement for us also to exchange information with the African Medicines Agency. We are participating in a lot of those technical committee discussions, and as they also start to define and clarify the requirements for their own systems, we then ensure that our information can then very easily be exchanged with ARMA. So compliance, looking at the regulatory requirements, making sure that our portal complies with the different legislative frameworks for data protection laws. Also looking at accessibility standards, as I said, super important that this is also interoperable. We also have a request to look at this then from a potential NDOH, NHI perspective, sharing then, for instance, information such as the list of registered medicines. Scalability, as I said, very important that we are able to grow the services and grow the additional features on this platform as we continue to evolve and further digitally transform. And then from a support and maintenance perspective, just making sure that we have got the proper technical support in place to address the issues. And of course, as we grow, to also be able to help us then develop and expand the functions and the services. Thanks, Cornel. I'm going to hand
Great.
over to you. Thanks.
Great. Thank you very much, Kristalna, for the introduction and overview. So just creating some perspective around what this portal has in place and is envisioned to have when it comes to features, looking at the bottom at the base framework, the different functions and modules and functionality that we've been putting in place over the past year, where it allows for multiple application types, where you'll see at the top, initially we're focusing on the health product applications and compassionate use medication, known as Section 21, as the base of that. So within health product applications, there's orthodox, biological, etc., with its different nuances of new applications, variation applications, and then renewals, which I'll get to in more detail. So application status tracking and management, there's different ways on how that is handled. Some of it is handled on external systems where we get the statuses back, and some of it will be handled within the portal itself on administrative side, on SAHPRA side. Speaking of which, like the ECTD integration, so integrating with those dossiers that gets uploaded. Then there is order and pricing calculation. So depending on what is being completed in the application itself, with the different variations and nuances in there, we can calculate the order. Then finance and EFT approval. So I'll show a little bit of that later in the presentation. Future-wise, looking at integrating with payment gateways, which also then integrates with the financial systems on SAHPRA side. User management and role management, like what Kristalna referred to make sure that the correct permissions is assigned to the different users externally and internally. Holistic organizational account management, allowing the applicants and different entities to manage their own users as well. And then unit and group management for reviewers internally, query management to try and centralize most of the communication within the portal, to reduce emails. Obviously, email notifications will still be sent, but the call to action will be to respond within the portal itself, and that alludes also to the communication notifications. So that's just a brief overview of some of the modules that's set as the base framework for the portal that we'll keep on building on. Then going into health product applications, new variations and renewals. So what I will be showing you is the user journeys in the form of some videos and some mock-ups of the different elements. So focusing on new applications, speaking to the ECTD validation, then variations and renewals. So let's start with HPA new. So this is an actual live demo of the staging environment that we're busy developing. So firstly, you'll be logged in as a user, create your new application. We've got a wizard to select which application type you're looking for. Orthodox in this example. You select the procedure type. So these are different procedure types that can be followed. New chemical entity, generic, the different variations around this. So this is a key section where you can now select your priority, where you can supply the priority number or the different types of application, evaluation paths, the product information. And as you can see there, I just want to pause as we're going through it. So this is a key component where we're capturing a lot of key data elements, which is also part of the envelope file when it comes to the ECTD dossier, where a lot of data lookups when it comes to the data standardization has been put in place instead of free-form text, which speaks to the ability to do a lot of reporting and analysis on the data itself. So route of administration is then captured. So dosage forms, again, data standardization there, indications, logical classification. Then here again, lookups of data sets to standardize data, which we will provide instead of free-form text. So there's multiple manufacturers that can be added or removed. So really focusing on the user experience and again, continuously keeping the data integrity in mind. Manufacturers, so this is a lookup database of the SNF numbers, supplying you with the company name and then selecting the type of manufacturer or the manufacturer role. Again, multiples that can be added. And then at the bottom, we also have a planned submission date, which is not a compulsory field, but that'll again assist SAHPRA from a capacity planning and knowing what applications at what time will be coming to play. Then moving on to the next screen, here you will notice that at the top, the application ID is auto-generated by the system. Then entering the different products and their strengths, again, data standardization, pack sizes, containers. So here again, for your application, you can add multiples. That's part of the ECTD. And again, the ability to then at the end indicate if there's duplicates, to then give the duplicates proprietary name. So as you know, again, a key component around this is that depending on what application type and how many products is added to the application itself, that influence the price calculation. So taking that into account throughout the system. So here your initial submission has now been created. Again, numbers are generated. Skip now, sorry. Skip back to the start. Let me just forward back to off. So there your submission has been created. And from here, you can now create your sequence, the different sequence types that will be accommodated throughout the process with different submissions, the specific contact for the sequence, and also add multiples there, their type. And then what we provide there is the FTP details. So let me just go a little bit back here on that screen. So in the system at the moment, this is created manually by the support team on SAHPRA's side. So on each profile, they'll have the ability to go and load those FTP details for you for reference to then continue to go and upload the ECTD. For this, then first step will be making payment, where we generate the order for you to then take to finance to then come back and upload the proof of payment for the specific order. And I'll touch on that a little bit later on how that is then handled internally on SAHPRA side. So throughout this process, as you've seen, we captured on the initial application information a lot of the information that is in the envelope and trigger file. Once you've then uploaded the ECTD to the SAHPRA FTP, the system does validation on the content of that to ensure that the different files, the XML files align. So we do validation on that, and then we write the trigger file for it to be processed to go through to DocuBridge. So again, there's checks and balances that's being put in place to verify some manual elements that's been entered on the existing envelope and trigger files. All right. Then a big part of the process and data cleanup is the legacy applications. So pre the reviewing platform that's been put in place over the earlier this year, there's a lot of previous legacy data that was imported into that system that's been being cleaned up. And along with that, there's a secondary cleaning up process in order for us to migrate all that data of existing applications that's in process into the platform to enable us to maintain the applications, the previous submissions, along with the sequence numbers that has been applied for prior. So you'll have the ability to come into the platform, search on your application ID, and we will then be able to get the required information for you to continue on the platform itself with additional variations or renewals, etc. moving forward. Then speaking to variations, so you'll log into your platform, go to applications where there will be a list of your previous applications, search functionality to search for the specific application that you'd like to do a variation on, where you'll then have the ability to select if it's only a specific application number, specific product that you want to do a variation on, or several of them. And from there, the process flows to selecting the type of variation you would like to do, so the submission type on that. And then as per the previous process, where you can then select multiple of the variations depending on the type. So there's some business logic that's being applied on what's allowed on the screen. Again, fee calculations, all those elements being taken into account. We can then provide the description on what the variation is about. Then from there, same process follows. It creates the additional submission for you to then create your sequence and make payment, and from there it gets processed. Then speaking to the variation type, which is transfer of ownership or relinquishing in this case. So again, a variation type where you can select what you would like to relinquish. Again, going to relinquishing type. From there, providing the information of the company it's being relinquished to, so in the form of CIPC number, where there's a lookup, so the lookup of the company name, or verify the CIPC number. And then again, on the acquiring party side, we'll make that application available once the relinquishing process has been approved for them to then do the acquiring side of things. Then moving on to renewals, again, similar concept where you'll go and search for the specific application or product that you would like to renew, and the same process will follow: a new submission, sequences, and then the payment that'll occur on that. All right. Then Speaking to the Order and Finance Administration, it was good to just give an overview of how that will be handled. Again, start a video. So this is once you've uploaded the proof of payment, like I've shown in the initial video, the SAHPRA administration will then log into their system, receive a notification, log into their system, where they will go to the finance portal, finance section, view a specific payment that came in, so they can see the order that's been given, and then the related payment. So they'll review the proof of payment, and this is a critical point where it needs to be the correct proof of payment that's been uploaded, correlating with the order, where it can be approved or then denied and disputed. And from there, again, notification will be given to come back to the portal to re-upload the correct proof of payment. And then from an applicant side, you will see that the application has been approved, and then from there, the next step will be to confirm that the sequence has been uploaded, because there could be an interim where you're still busy uploading or haven't uploaded. So we need confirmation that that specific sequence, ECTD, has been uploaded to the FCP for the rest of the process to continue, then be sent for review. Okay. And then future plans is to also incorporate actual payment gateway. So there's a payment gateway Flutterwave that we will be integrating as a future phase, where you will be allowed to pay with different types of payment types, credit cards, instant EFTs. So that's a future enhancement that we want to make to enhance the payment process, to avoid manual recons on the payments, and that also speaks to future integration into financial systems, so that it's more instant and real time to add additional efficiencies to the process. Right, and then on to user registration and management. So this will be the key first step, and it's important for all the companies and entities that's going to be applicants to go and register on the platform, especially when it comes to data migration that we're going to bring in with the CIPC numbers that's related to specific entities for typically the legacy lookups. Again, from a security point of view, we'll ensure that based on the company registration numbers, if you do a lookup of a legacy application, you can only see your applications to continue on. So a little bit of the user structure. So for external users, there can be individuals, and this might be more applicable to Section 21 applications. And for companies, there's a structure of the company where there's a company administrator that registers initially, and then they can invite additional users. We will also be introducing an extra tier where within a company, there can be different sites or divisions of the company to add an extra layer of user permissions for different users to only see specific applications within the organization. Flow. So the first step will be to go and create an account. So as a company, there's different types of organizations we've identified. Again, speaking to fee structures with certain applications like Section 21, some of the application fees, some of the applications don't have fees applicable. So your organization name, allow for the address to be entered, the CIPC number, which is critical. Again, then there's additional compliance elements that we cater for in the platform. For example, expiration dates, and then uploading specific company documents. Confirmation of the CIPC for that to be verified. Then again, on the personal information of the first user that registers on behalf of the company, doing several validation and asking information upfront from a compliance level, like the HPCSA number, and again, the certificate, which becomes a critical factor down the line in the process for different applications. In the example of a only registered pharmacist, for example, is allowed to do specific applications. Setting your password. So again, this will be the first user that registers on behalf of the company. Again, keeping the platform clean from a security point of view, standard email verification that needs to happen in order for the user to log in. Moving on to the second step. So go to the next user, next slide. So now the company admin or the first user of the company has registered on behalf of the company. Now the ability for them to go and invite their additional colleagues. So within this process, so now it's John logging in, the original user, admin user. They can now go and invite additional colleagues. And there again, there's two permission types, either just the individual or additional organizational admin. So if you've got a colleague that needs to also administer and invite additional colleagues, they can do that. Invite gets sent. Going back to the email. Sarah has now received her invitation and she can now go and complete her registration. Again, putting the onus on that individual to then, depending on their profession, upload specific information that's related to, in this case, it is a pharmacist, asking for the SAPC number, expiration date, and then the proof again. Okay. Then throughout the process, Christelna referred to that as well, where we now focusing a lot about data and reporting and getting insights around the platform. I'll hand this back to you again, Christelna, to maybe elaborate about the detail and the insights.
Yeah, thanks, Cornel. Yeah, so I think for us important there is two kind of views that we'll be having, you know, from a portal and data warehouse perspective. So one obviously lives within the portal itself, as you've seen throughout some of the little videos, you know, at a user level or account administrator at level, you would also be able to see, you know, who are all your users, also all of the applications that has been logged for your specific organization and what the different status is of that specific service request that is in the system. It tells you also what the service type is, and you would then be able to kind of have that holistic view of all of your specific organization's requests. Also, I think some of the internal facing dashboards, we have, as I said, through the applications process and us collecting a lot of this information. Cornel also touched on the fact that, you know, it's important for us to use standard terminology, standard references. And as we then are able to pull all of this metadata fields across into our data warehouse, we can then also provide richer reporting structures as well as dashboards. This is just a small little example of what of the mock dashboards look like for our Section 21 applications process. So really very nice because it's interactive. It also allows a unit manager or one of the SAHPRA users to drill into some of the further detail that they need to get into to manage their process, or perhaps follow up on an outstanding item or something that is nearing the service target. And I think we obviously will also be exploring, you know, what kind of reporting and dashboarding we also publish to the website. Specifically, one of the elements, as I said earlier on, that we want to do is through the data warehouse also then publish our medicines registration database. as well as then the database for all of the licensed entities, reflecting then, the relevant information, statuses, renewal dates, expiry dates, issue dates, all of those information that we at the moment we've got on some of the manual trackers that are facing externally through the website. And the intention then is to connect that with the data warehouse so that hopefully as we then continue to digitalize all of the processes, we then have those kicking in real-time fashion, making the information more and more valuable as we go along. Thanks, Cornel. Yeah, sorry, this is probably the better view of it, right? And as I said, just looking at this, yeah, I always say to Cornel, it looks so pretty. It's aesthetically very pleasing for us internally to start looking at our data in this way. And really nice to see this information actually coming together so well. Because I mean, we can only manage what we can measure, and now we can start measuring these things a lot more efficiently and effectively. And we hope that this will then also result in us, kind of like unblocking the drain in some areas and then creating all of those operational efficiencies, which we have been working towards. Thanks, Cornel.
Great, thanks, Christina. Yeah, I think by capturing all this data in a more structured way and having the data, it really does bring a lot of insights to life. So, like Christina mentioned, I think a lot of efficiencies and insights that can be gathered on planning and being more efficient once we have
Yeah, it's
visibility on the data.
Yeah, it's the resource management, to be honest. I think, Cornel, that we are relishing is making sure that, we can kind of like, as I said, those bottlenecks or blockages, making sure that we've got the right resources allocated to the right activities, and we don't have dwell time anywhere. So yeah, I mean, it's how can I say, operational efficiency expert's dream. So yeah, we're getting there. Thanks.
Great. Then speaking a little bit about future phases. So obviously, as I alluded to earlier, we are highly focused on the HPA section of things, along with the Section 21 section. So just want to touch on that. So now that the base components is in place, and obviously there's further rollout when it comes to veterinary medical devices within HPA and Section 21, where we focused on the initial orthodox and biological flows. There's a lot additional rollouts that can happen there, but now that the base is in place, it's kind of a rinse and repeat to just roll that out and adapting the forms and all the elements and integrations that needs to happen there. But this is just an overview about all the other processes that's still in the pipeline that needs to be tackled. So next priorities that we kicked off is the clinical trial applications, and thereafter will be licensing. And all of this, especially like licensing, is intertwined with the medical the HPA applications when it comes to lookups and all those things. So all these processes will start integrating and speaking to each other because there's a lot of overlap. But on the left-hand side, then just showing all the other processes that's in the pipeline that needs to be addressed in the same form, where there's Section 36 applications. There's a long laundry list of things that we will start tackling over time to also integrate into the portal to really make it one central place for any applications and reviewing that'll happen from SAHPRA's side. All right, and then process moving forward, Christina.
Yeah, so this is probably what I think most of the colleagues would be interested in, is just what timelines look like. And I think for me to talk to this, whilst everybody is running their eyes over the screen, I think it's important that I also just create some context. What we've seen, and I think what Cornelia has taken us through this morning, you can imagine this has taken us quite a bit of time and brain power to map out, work out, run through different scenarios, try and make sure that we kind of don't have any blind spots. And And as I said, we got off to a cracking start in January. And I think for January, February, and March, spent quite a bit of time just kind of setting the ground rules and understanding, what the SAHPRA organization looks like. As you can hear, Cordelia is already starting to use the terminology very easily. So we have SAHPRAfied also our technology consultants. But we also had to shift our focus over April and May to the implementation of the DocuBridge software tool within the organization, as I said, part of the core business back office processing system. And unfortunately, yeah, I've also been waylaid a little bit, having had to take some medical leave over June, July. So as a result, we've had some impact on our original planned timelines. And I think with best intentions, we were trying to get at least the 1st of October aligned with the ECTD 3.1. However, with a recent item that we've uncovered, where we had a bit of a blind spot, we also now have had to adjust and do a bit of further work and polish in terms of taking our user account registration live on the 1st of October. So this is now planned for 1 November. And I think tied to this as well, on a point of interest, we have ECTD 3.1 going live also 1 October. However, the ECTD 3.1 1 October go live is optional. I think it allows us as well over the month of October to then iron out any kinks that we may have with the 3.1, and then aiming to have that mandatory for 1 November. So 1 November, we also have on the portal then the application that will go live to allow organizations and users to start their account registration. And we specifically have allowed the month of November for that, because I think there is quite a bit of activity that will be happening in and around that. We also will be publishing an expression of interest to applicants. We would ideally like to invite a group of about 5 representatives from industry to participate in the HPA applications testing. So we have obviously, before we want to take that live in the production environment, we want to also then expose industry colleagues to this in the test environment, running through then 5 applications of new submissions, 5 applications of variation submissions, and then 5 applications for renewal submissions. And this, because it is in the test environment, we would ask then applicants that are interested in coming to play along with us to bring test applications. So it could be something that has been submitted in the past. It might be something that you intend to submit going forward. But basically, we want to have a face-to-face kind of like testing session. Sorry, I think the dates are the 2nd and the 3rd, because I'm sure nobody wants to come in on Sunday the 1st. But we will be doing that the Monday and Tuesday. We'll be actually taking in the application. So literally running through, sitting in a room, running through that application, walking it through step by step, doing the upload, and then ensuring we are able to take in these applications. We then have looked at the different kind of anomalies or scenarios that we might encounter. If there are any further items for enhancement, that we're able to put that on our enhancement log. And then the intention would be kind of like to hand that over to our HPA team to complete their administrative process, as Cornel had indicated. So once we've got those applications in, the mock process around doing the payment verifications, also then stepping that through and running through kind of like a mock review, mock feedback, issuing of queries, etc., etc. So this basically what we would want to do from let's call it then the 2nd of December until the Friday of the following week. After that, I think internally we will then consolidate our testing feedback. As I said, look at the enhancement log. We are mindful of the fact that some of the colleagues might be doing a festive break from about mid-December to about mid-Jan. So also on our end, we then intend to consolidate that testing feedback from middle of December, but really only start the refinements and updates across the January, February. And then for March, we basically would be doing the last preparations, last activities, as Cornel says, also the migration of legacy data from our core business processing system, the DocuBridge environment, bringing all of that data across so that we are able to process then also the legacy applications. With that being said, we also just want to flight that we will have a administrative pause then again at the end of March. And we do take note that we wanted to communicate this well in advance so that any plans that applicants might have to do submissions in that first quarter of the new calendar year, that please reaches us then before the 21st of March. So that week of the 24th, basically to the 28th, is when we will be just going into that admin freeze period so that we can do the final updates on system statuses within the DocuBridge environment. Last of the registration committee updates following that meeting on the 25th. So that we are able then to take that data set and migrate the information across to the portal in order for us to have then a go live for taking in new HPA applications, variations, as well as renewal submissions from the 1st of April 2025. And this is aligned to the start also of our new financial year. And specifically for this reason, as we were not able to hit the timeline for 1 October, which is our half year mark, we now have brought this to the start actually of the new financial year. But I also have to say, considering the fact that our data looks a little bit like me, a little bit too chubby and maybe a little bit too roly-poly in some areas. We obviously need to clean up the data and slim it down a little bit. So it also gives us an opportunity to do really a good job with further cleanup, data standardization, and data normalization. And honestly, we've seen even with the import of data, from our old document repositories into our new DocuBridge environment, that it has at times posed a little bit of a headache for ourselves, for our software vendor. And as a result, sometimes it was a little bit more difficult getting some of those older transactional data across into the new environment. And this is something that we then at least allow ourselves the opportunity to work through and make sure that we have a bit of a cleaner and an easier transition of legacy info into the portal. So we hope that you will continue to bear with us. I must say I'm a little bit disappointed that we had some unforeseen activities take us a little bit off course, and as a result we couldn't hit this half year go live date. But I think, and hopefully you will agree, just by going through some of the data and the information that we will share today, that this effort that is being put into this portal is really going to give us, as South Africans, something to be very proud about. And I say that on the back of some very encouraging comments I had this morning and yesterday from some colleagues who is attending a conference in Berlin at the moment, where we've got a lot of other global NRAs coming together, where they also were able to sit through a presentation done by Health Canada about what Health Canada is doing with their portal. And it was just amazing to hear that all of these lovely things that we are putting into the SAHPRA portal are the same things that they are thinking about doing as well, looking at and hoping to implement in the future. So very encouraging, quite a bit of hard work, and yeah, certainly as a result, taking a little bit more time than what we would have hoped, but certainly I think it'll be well worth the effort. And as Cornel says, the exciting thing is once we've got the basics properly locked in, the rinse and repeat, as he puts it, to get the rest of our processes online, licensing, Section 36 applications, etc., is going to go quite a lot faster. And that is something that we're really looking forward is to now ramping up the rollout once we've got the basics in. Cornel, then I think what we can do, colleagues, just considering where we are an hour in, we also have some extra content that we did want to share with you around Section 21. Before we do that, let me just run through maybe some of the questions that we've got in the Q&A, and then we can perhaps ask Cornel just to share the rest of the slides and some of the information on Section 21. I think it would be really interesting for you as well to see what we've been up to there. And that, you know, it's not just effort that's gone into the HPA processes, but we also have made really good progress. And it is likely that Section 21 will actually go live before health product applications processing, but there will be a next webinar more towards the end of October, where we then have a specific session for people that are interested in the new Section 21 portal interface, and then also that announcement of the go live date. I think tentatively we are at this stage also looking at mid-November to beginning of December, but that we will firm up very soon. Right, so I'm hoping, let me just scroll down to all the questions here, and just try and take them in the right sequence. So I'm going to go all the way down. Please bear with me. I just don't want to start taking them out of sequence and then losing my way. Me and the Q&A are sometimes at logheads. All right, let's just make this easy. Right, so I think there was a question around the resulting availability of data for interdepartmental DRH PC. I'm not sure, is that portfolio committee? I'm not sure. And other efforts will be invaluable. Gerard, thank you very much. We believe so as well. We've had some discussions with NDOH, and they really are looking for one source of the truth when it comes to product information. And as the colleagues would note, we also recently published our guideline around GS1 or specifically traceability standards. So we introducing the GS1 barcoding. So this is something that is quite appealing to our colleagues in terms of having then on a product and collection of information for product data, standard information, the information around the pack sizes, the different barcodes for the product, because obviously as NDOH is also trying to improve their systems for procurement, forecasting, and even the management of inventory within the Department of Health, use of these standard reference information for what is a product, and a product is a product, and we call it this thing, and it's not called something else because it lives in a different province, perhaps. This becomes really important. So fully agree with that, and thank you for that comment. Then we have question during refinement and changes in month Jan-Feb. Does this mean an update in ECTD 3.1 specifications 2? So no, at the moment, we have the 3.1, which basically, I think if we look at this kind of like from two different perspectives. So for the ECTD and the ECTD processing side, 3.1 specifications as we have it, they will still be in place in January and February. However, when a change is required, it may be in January, February, it may be in March, April. It just depends on if there is something new that we need to accommodate. But I think what we did say is that we would hopefully try and keep the 3.1 static for a period of time so that we can just allow ourselves an industry to adjust to the new specifications. And also then when we do an update to push out a version 3.2, that it would then be something that we will again allow for a 6 month implementation period. So if we do communicate, it might be something again which we publish in March for again an implementation probably then in an October. But that would kind of be the cycle that we would want to stick with. So if there are changes, we do publish, but there will always be a period of 6 months where we then allow for the relevant software vendors also to accommodate any changes. Right. There's a question. Does this mean that we continue submitting via FTP portal for ECT biological products in CE applications and variations? Yes, that's exactly what we'll be doing. Nothing basically changes from taking in or submitting to SAHPRA your health product applications. As I said, until the 1st of April. But of course, as we continue the dialogue and we will continue from HPA side to engage with you, continue the webinars, make sure that we keep you updated and we take you along on this journey with us. We will run another set of webinars likely across the beginning and end of March, as we then prepare and refresh our minds in terms of getting ready for 1 April. So that will be the status is to continue with matters as they are, please, until the 1st of April. Can anyone in the organization register on the portal admin, or should it be the RP of the organization? So for, I think, let me say there's different scenarios, right? So maybe let me put it this way. For an organization that registers that perhaps has a responsible pharmacist appointed and associated with the company, the registered entity, that responsible pharmacist will be the one that registers as the admin on behalf of the company or the organization. If that company has different sites, trading sites, distribution sites, whatever the case is, they would then invite the responsible pharmacist for the other licensed site or sites to then become co-admins with them. So they, as the RP associated with the license for the registered entity, is then responsible for doing the first registration, inviting their other co-admins for the other licensed entities or licensed sites. And then those respective responsible pharmacists at each different licensed site would then continue to invite users for their specific site. If it is a scenario where you only have one responsible pharmacist for one company, then that responsible pharmacist will be the one that registers on behalf of the company and invites other users. Same for authorized person. So as we continue with the rollout, as I've indicated, as we tackle licensing as a next step, we also obviously accommodate then for authorized persons to also then be the person that would be the admin that registers the account and then manages the invitation for other users in their organization. From time to time, sorry, for the time for registration going live 1 November until actual go live 1 April, will submissions stay as current using trigger file? So yes, as I've indicated, we will not be changing anything in the way that we're submitting. So the trigger file will remain until 1 April. And then as Cornelis indicated, from 1 April, we actually create the trigger file through you filling in the application form. So we then manage that transfer of information to our DocuBridge system with the integration. But until the 1st of April, the usual process of trigger file and application via FTP will remain. There's a question around, is there a limit on the number of users? No, we don't have a limit on the number of users. Is 1 November the mandatory implementation date of ECTD 3.1? Yes, 1 November is the date for mandatory ECTD 3.1. 1 October is optional. So any applicant that is ready to submit as of 1 October should please continue to do so. I think we do want to take in applications from 1 October in 3.1, specifically to make sure that any sort of unforeseen challenges with perhaps validations or the document matrix we can attend to and resolve those. But from 1 November, we would want to have the 3.1 come in as mandatory. As mentioned, okay, so same question. Right. So there's a question around how do we register to play along for the new variations and renewals applications. So on this one, the HPA unit will be publishing communication to industry, and I'm hoping to do so, if not later today, at the latest on Monday. We will, in writing, confirm then the timelines, the adjusted timelines for 3.1, as well as the timelines for engagement portal, and also extend an invitation then for companies to express interest in becoming part of the focus group. We will then provide the email address to which you may submit your emails expressing interest. So that should be going out, as I said, later today, if not very latest on Monday. And then we will take in the emails. I think we intend to allow until the 30th of September just for those EOIs to come back. And then in October, we will communicate with the companies that we have shortlisted, and then just make the relevant logistical arrangements for that testing cycle in December. Right. Question around, will the DVP be commissioned once the portal is live? Yes, that is exactly the intention. So I think at the moment, the colleagues had used the DVP or reactivated the DVP over June, July for type 1 for inspectorate in order to access those variation summaries. And that indeed is then something that is well catered for in the portal. So from the 1st of April, we will only be using the new SAHPRA portal and no longer be taking any applications through DVP. The information, however, will still be available then for a period of 6 months before we then archive that DVP instance in the SAHPRA server archive. Right. There's a question around for 3.1, the submission number generated by the SAHPRA portal is required to be included in the envelope meta. How will we action this if the portal is not live? So for 3.1, I think the submission number and the guideline in the trigger file, as well as then the guidance that you have been using thus far for 2.1 is what will be used to populate the envelope meta as well as the information on the trigger file. So as I said, we don't want to change anything with the way that we're taking in the information until 1 April. Let me just see. There's just a question around, will the portal also manage wholesale pharma and medical device license renewals applications, payments for retention fees, etc.? So yes, this is actually the next phase of the development that we want to start with now at the end of the year. So we want to start getting some of the business process discussions and the blueprinting happening. Our licensing units between orthodox veterinary biologicals from Jerry's side have been working quite closely together with the team in medical devices with Buseletso, and then also with Kaiser for complementary, so that we can start to harmonize the application process, the application forms, the management of those applications, and then the standardization of the actual licenses themselves. So just getting those templates firmed up. And because this has been happening and is really nicely on track, we are able to actually start having the business blueprinting discussions. As you can imagine, trying to digitalize something where we've got too much variety becomes quite a challenge. And therefore, we are obviously aiming to have a more kind of a vanilla process so that we can do the vanilla development, if I can put it that way. And then, of course, for those small permutations and the extra bits and pieces that we need for this kind of medicines category or that medicines category, we then build that in. But yes, this is actually the very next item on the priority list is licensing as a whole. And indeed, the intention is to take in new applications, amendments to licenses, as well as renewals. And then through that process, as I said, make sure that we've got a very nice database feeding off of this information that will collect information around the date of issue of license, then auto-calculate, of course, when that renewal is due, and of course also have the information around the retention fees. We then have the process that gets kicked off by the portal where we will send automated reminders 6 months prior to renewal, just to advise and remind applicants that renewals submissions are due. And of course, for the retention fees, we do the same, so that the retention fee reminders and those order values are then pushed out in a timely manner. And of course, then payments can also be facilitated and proof of payments then uploaded through the portal. So hopefully then a much more streamlined process. And again, just giving that visibility both to yourselves as well as the colleagues on this side around what needs to happen, what needs to get paid, and when. There's a question around category D medicines, if the portal will also cater for category D medicines. So I think we have the applications for category D licenses currently running through the complementary medicines portal. And that will remain until we have the process established for managing licensing for category A products and medical device and IVDs. And once those two specific areas have gone live, we will then look at transitioning category D into the same portal environment for managing the licenses. As for the products, so as indicated in the little video, at the moment we have focused our health product application registration process on orthodox medicines and biological medicines, as they currently in ECTD. So as we also then roll out CTD e-submissions for veterinary, then the e-submissions for medical device TOC, I think depending on their roadmap and what their feasibility study looks like, as well as then complementary medicines based on their roadmap. These will be facilitated through the portal. So basically the application form gets filled in, all of the relevant particulars will be collected, and then whatever that submission format looks like at the end of the day, the units will inform us what kind of format that looks like. Is it a zip file? Is it a PDF or whatever the case is? We will then ensure that we facilitate the receipt and the submission of that particular application format as well. There's a question around co-applicancy. So I think, again, just the portal feeds, when it comes to health product registrations, the portal feeds a lot of its submission types and application types from the DocuBridge environment. So therefore, whatever changes are effected on the DocuBridge environment to facilitate co-applicancy process, it gets updated then accordingly on the portal. So on the portal side, other than just having a different, let's call it then pathway to select from the drop-down list, nothing really changes from that perspective. But I think probably for applicants that have interest in submitting co-applicancy submissions, Pratiba would have different one-on-one discussions to walk you through that process. It's more, I think, around compiling the ECTD and making sure that the ECTD is received by our DocuBridge tool. Will additional pack sizes be allowed in the same cell, or will we need to repeat the string for each pack size? So ideally, because we are looking to use data for reporting, it's not helpful for us to collect the data in one cell, because it then becomes difficult to use that in a report or to analyze that data. So therefore, if we want to add pack sizes, we will need to then just add that as an additional pack size on the same strength. There will be an option, little plus button for that. Right, so will only pharmacists be allowed to register companies? What about companies like laboratories, etc.? So as I said, the system will make provision for authorized persons. So for a particular organization, if you organization that is not a pharmacy or pharmaceutical manufacturer and your laboratory, then obviously you would have your authorized person, and whatever particulars is relevant then for your authorized person to populate, that will be then accommodated in the system. Question around training videos. So I think, yeah, as we get to March, what we have on our, what do you call it, Go Live action plan is that we will be issuing a short little how-to reference document, and also then the training videos. Indeed, as we run through the process, Cornel has just indicated how we have these short little videos that we compile. So certainly for those running through basically application process per process or service type, is then also something where the short little video will be available, as well as just a very nice little quick reference guide. Right, I see we're almost at 10:30. I'm going to do 5 more minutes of question, and then I think maybe I'll hand back to Cornel to take us through section 21. And then obviously any questions that I can't get to, we will copy and make sure that we put in the FAQ document. Let me just see some of the questions that's been asked and answered. I will skip over. Okay, there's one thing that says for direct payments, will it be possible to add company finance personnel? Yes, if you want to add that user to have access to the portal, that is then something that you can do is you can extend the invitation. They can create their user account, and certainly they would be able to then also have access to the account and your dashboard and the relevant info. Can a company holding both pharma and device license apply for just one account? So I think in terms of account administration, so this is the important thing, and hopefully, well, maybe it seems we didn't explain that too nicely, but for a registered legal entity, if your company is, for instance, Pharmaco Pty Ltd, and you've got a company registration number, your CIPC number is XYZ, that legal entity holds the company account. However, that company account may have a trading as Division 1 and a trading as Division 2 that can be linked to the company account as then trading sites or trading divisions. So the user account administration then, if your company currently has a pharma license and a device license, I'm assuming that it's still one legal entity registered with CIPC, and therefore what you would then do is register your main company and then just add your two trading as sites, so that you can then link specific activity for either your pharma product or your devices products then to those trading as sites. And then the users looking after those different trading as sites would then be linked to the different trading as sites under the main company. Um, right. Mm, Now I've already lost my way. Might have missed a few questions. Sorry. The Q&A on my side's refreshed a little bit. Okay, I think we did cover the issue around relinquishing and acquiring. Because is it mandatory that API applications be submitted from 1 April via this portal? Do we have a step-by-step guide to request login credentials to this portal? Okay, so I think that's the maybe just yeah. Let me partially answer that question. So for the account administration, as I said, we will do a short little video and a quick reference guide, which we will then share also on the website in October, so that when user account registration opens up in November, that you are able to register your account. And if necessary, we can certainly have another short little how-to closer to the end of October, just to take everybody through how to register an account again, make sure we do a bit of a refresher so that 1 November folks are comfortable just to start that process. And of course, if anybody does get stuck along the way, we are always available and ready to assist. There's a question around invoices for payment to SAHPRA issue all applications, including variations or just new applications. So any kind of service that you would log a request for through the portal, if that service has an associated fee, there will be a sales order that we then generate within the calculated fee that's payable to SAHPRA for that specific service request. So it could be for new applications, for variations, as well as for renewals. It will be the same for Section 21 applications. And then obviously as we start rolling on licensing, it will be the same for licensing. New license as well as amendments to license, and then of course renewals. And for separate processing across the registries, also then retention fees. Sorry, so does HPA legacy data include post-registration variations applications which are still pending outcomes from SAHPRA? So if there is a sequence that has been submitted for a specific application number, we will show that sequence as pending. So the same status as it is in DocuBridge will show in the portal. Let me just see. Cornel, there's a couple of questions, but maybe let me pause here. I think let's just cut through and go through maybe the Section 21 process. And then what I can do is I will just ask Ntokozo to help me with getting the rest of the questions so I can answer them in the Q&A document.
Perfect. Happy.
I can now take a sip of water.
Good. All right. Let me in. All right. I'm going to take you through the Section 21 side of things. I think this will bring the concept home around how the rest of the process will also fit in. We focus now heavily on the HPA applications, but showing another application will contextualize the bigger scheme of things. Things will tie in as we start rolling out the rest of the business processes. Okay, so Section 21, a named patient application. So I know that is referred to as Section A application. So Section 21 application in the wizard, Section A new, and then we're introducing reports and reauthorizations as well. So Section 21, individual named patient. Some wording changes around the legacy bulk application, which is now multiple patient application. And the only difference there is with individual, you know who the patient is and the exact treatment, whereas with multiple patient, it's multiple medicines that's being imported, and then again introducing the reporting where that specifics then gets needs to be reported on which patients it was allocated to and what the prescription was. You then tally up if all the medicines have been completed or have been used. Otherwise, it needs to be either the extension needs to be applied for or a destruction notice needs to be added. All right. So going through the named patient application. So again, trying to focus on the user experience side of things with wherever we ask for a specific question like HPCSA, it's right there for uploading, allowing multiple entries where applicable. So this is the particulars of the applicant. Then continuing with the wizard, again, user-friendly, showing where you are, validation, again, lookups based on different registries and data sets we have when it comes to importers. As an example on this screen, particulars of the patient, again, uploading where required is available. This is the diagnosis information, again, referencing to more data sets like ICD-10 codes that we've introduced here from a reporting point of view. Particulars of the unregistered medicine, looking at data sets that we have available for lookups, API manufacturers, again, inputting that, uploading of prescription, PIL information. Then this is an interesting one that we also introduced is based on the information that is given on the prescription itself. We can then do a calculation on the actual packs that's available. So a little bit of validation and checking on the information that's being compiled to assist in the authorization letter on how many can be brought in or imported. Then speaking to the reports that's due. So now this is the after the application has been approved. So depending on the duration of the treatment, we expect a patient outcome report to be submitted. So this would be your previous applications with the status after it's been approved, moving to a report is due. And this is typically what the report will look like. So that's the treatment outcome of the patient, of the treatment for the patient that needs to be submitted. Yeah, so this is just a screen of showing the user experience of toggling between the different applications. And then the difference between the HPA application, where the reviewing happens in a separate system, from an administrative side and a reviewing side for Section 21, and some of the applications moving forward, it will happen on the portal itself. So the reviewers will also be working on the portal. And with Section 21 having a 3-day turnaround as well, we focus quite a lot to see how we can make it as easy as possible for them to review, again, trying to introduce efficiencies in the process. So there is specific review criteria that they look at, and also different reviewers, technical and administrative screening that happens, then passing it on to the unit manager to review, and then the senior manager for sign off. So as the application came in those different sections, we're breaking it up into these different sections for them to review. So easily to navigate. Then there's the specific review criteria that they're looking at, which they can then either say it's correct, or incorrect, or then make a comment. So if there's a comment being made, different information that can be uploaded, and then they can either flag it as an internal comment for the other reviewers later down the chain to consider or look at, or they can then send it back to the applicant. So it's a kind of a two-way communication to fast track it. Again, a notification will be sent to the applicant with the specific relevant comment. For example, the HPCSA certificate that they uploaded is corrupt or is accidentally an older version that has expired, for them to then receive the notification, come back to the application. There will be a link in the email to bring you to the correct application, and validation will be put on that specific field to then correct and then resubmit. So that's just a short, in a nutshell, overview of Section 21 to, again, showcase the principle of how the rest of the processes can be onboarded in the foundation that we established. Cool. That's it. Let's move, Christella, back to you.
Great stuff. Thanks, Cornel. Colleagues, yeah, so I know we finished a bit earlier than what we planned, but I hope at least that we've been able to give you a good sense of where we are, what we've been busy with, and I think quite importantly, just when the next activity will take place and what that activity actually will look like. And then along with you, we are very excited about getting this, how can I say, going, and really just, yeah, observing where the rubber hits the road, what this will actually do for us as an organization, as well as also how we will then improve the interactions and engagements with yourself as our stakeholders. I have noted there were some extra questions that came through onto the chat, so we will make sure then to pull all of these through. I think just in terms of confirming that the recording of this session, of this particular webinar, will also be available on the SAHPRA website. So please do go and visit that recording, and where we go through some of the details and particulars around the processes, to have a look at that again. Interesting question, Cornel. Actually, I just out of the corner of my eye glanced that that's an interesting one for me to ponder, for us maybe to think about. I know that we've got obviously our plans to do the test with our focus group, but there was a question around whether or not there is a possibility for a test environment for companies to, kind of play on their own. Perhaps maybe after our pilot in December, perhaps something that we could consider opening up for February or March, just to get people a chance to orientate themselves, I suppose, in a play environment. I will put that on my wish list, and then we can maybe chew that over. But that was quite an interesting suggestion, actually. And then for the rest of the colleagues that had questions on the Q&A, thank you very much for engaging with us. I will, I think, also try, just considering maybe some of the questions I saw coming through on 3.1, October, November 3.1, is this what we're expecting, that what we're expecting? Maybe what I will do then is actually just try and bring in some further clarity and granulate specifically what will happen 1 October and what will happen 1 November, and then what the expectation should be around 1 April, just to make sure that we have that very clearly communicated with yourselves in writing. So I will delay in issuing the communication from HVA today, so I can just accommodate adding all of this extra bits and pieces of info, and we will then issue that on Monday. So for everybody that had a question around the 3.1, I will then go through these questions and make sure that I cover hopefully that question in enough detail in the industry comms that we'll set out. And then, yeah, I think we can actually close off a little bit early and give you back 19 minutes of your time. And again, just a very, very big thank you to everybody that joined us for this morning session. And we really look forward to having a few more of these as we go. And we hope to see you there as well. Thanks very much, everyone. Have a great day.
Thank you. Thanks, everyone. Bye-bye.